People experience a COVID-19 infection differently. As many as 1 in 5 had symptoms for up to a month. However, some people still have effects many months later. These patients have what is known as long COVID, chronic COVID syndrome, or long-haul COVID, as we hear from infectious disease specialist Dr. Hua Jiang at Methodist Hospital of Southern California.
Long COVID, it's a very loose term. It usually describes people who have long lingering symptoms of various kinds, may be associated with COVID infection because these symptoms develop after they recovered from acute COVID-19.
Dr. Jiang reveals an official name for this condition and the various symptoms.
It has been given a name. It's called PASC, post-acute sequelae of COVID-19. The symptoms vary from mind fogginess, fatigue, difficulty breathing from time to time, difficult concentrating. Some patients will say they have forgetfulness. And the most common one is the loss of taste and smell. Those symptoms were considered acute symptoms, but they actually lingers around for a very long time. So those are also part of the symptoms associated with long COVID.
More data is needed to determine who is more susceptible to get long COVID.
We do not know for now whether there's any particular group of patients get long-term COVID symptoms. There's certainly some suggestions saying that maybe female patients are more likely to develop long-term COVID symptoms, but it's not quite thoroughly studied whether there is actually a differential between gender or age, and not even between the severity of initial infection. Some people very, very mild symptoms with COVID at acute stage, they still develop long-term symptoms.
There now may be help to alleviate symptoms, the COVID-19 vaccine.
It's actually not a rare phenomenon. A lot of people seems to get better with the COVID vaccination. They have long symptoms, then after COVID vaccination, they feel much better. It's anecdotal. It has not been studied whether it's a causal relationship or just pure coincidence. But I think it's probably more than just coincidence.
How long does COVID last?
It's interesting, most people think long it should be measured by years instead of weeks or months. But remember, COVID, any infectious diseases, unless it's chronic infection, considered acute disease, they're not supposed to last more than, say, 2 months. If anything lasting more than 2 months is considered long or subacute or even chronic. So anything lasting longer than 3 to 9 months, it's considered long after acute infection.